By whom aid to Almighty, all my gurus and Pandit Pranamji and all senior faculties, friends and esteemed delegates. Myself, Dr. Karmasaphalya. My given topic is Pashat Karma. Next slide, please. Today I would like to cover few points. Among these, many of the points here and there, even previous speakers and their resource persons they have already covered. When Pashat Karma, with special reference to Shodhananga Snehana, it starts from the immediately after the administration of the Shodhananga Snehana. As all of you know that very well. Yes, Panch Karma carries three stages. Among Pashat Karma, you will be the last karma of each and every procedure. Especially for Shodhananga Snehana, what are Pashat Karma? Pashat karma can be classified into two aspects. One is Tatkalina karma, which is immediately after the procedure, what you are performing, that you can call it as Tatkalina Pashat karma. Later one is that is Kalantara, still the end of or still the completion of what we have aimed for either Romana or Vivechana or other Shodhana measures. That is Kalantara Pashat karma. As all of you know that in present era, the practice of Panchakarma is very easy as compared to the Shodhananga. The Bhayaparmarjana practice is very booming and it's more attractive. When questions comes about the Shodhananga Sneha, most of the patients and even it's widely indicated also. Apart from Shodhananga Sneha, all other Snehas is not widely indicated and used in clinical aspect. Even in such conditions, the practice of Shodhananga Sneha questions comes practically is very difficult because more are dropout cases. When patients comes with very enthusiastic, sir, I have obesity, I need to lose my weight. Sir, I have thyroid, I want, because as it's indicated in case of autoimmune diseases, obesity, metabolic disorders, diabetic, hypothyroidism, and even musculoskeletal disorders, and more than that, neurological disorders, and even infertility too. If list is goes on, never ends. In such conditions, what the present clinicians or even the practitioners, what best we can make a modification during the Abhyantara Snehapana, and what I have observed in my clinical experience. See, as in classics told that there is an Ushnodaka Upacharya and as well as Upasrisha. Ushnodakena Upasrisha. That is one class. Immediately after this Snehapana, Ushnodaka Upacharya. When we need to start. And even before that, 1 second, I will go back. Even while taking the Snehapana also in classics, they mentioned the person should be always, we are talking about the person should have very good strength, very good Agnibala, very good physical strength. Along with this, even Uttama Manobala is ideally required and it's having more weightage than the physical and as well as Agnibala itself. Because in clinical experience, everyone is noticed that the person will take Snehapana, everything on the course of Romana, they will get the tremors, panic tremors because of the power effect of the Manobala or what you can say, the poor mental status. Okay, in order to avoid all these things, first and foremost, before administration of this counseling is very, very essential, as yesterday Dr. Shilpasri Madam also expressed. The proper counseling before Shodhananga Sneha that will successfully minimizes the dropout cases in our clinical practice. That's one point. Second thing, see, if the adult is there, highly educated is there, then we can counsel properly. What about in case of mental cases or even Manavas, Rotagata Vikara? What about in geriatric cases and what about in case of the pediatric condition? These are the tasks and even the challenges in front of the Panchakarma practitioners. When we people are unable to show the appropriate result, in case in terms of the Shodhana, people they will not show their Dhana to us. Okay, this is the logic because otherwise you will not get any name, fame, and everything, or even the purpose is not going to get solved. So here I made some of the little bit variation in my clinical practice. as they told, even what are the Tatkalina Vyapas we can observe or we can face during this Snehapana practice. First and foremost thing is immediate vomiting, one aspect. Second one is nausea. Third one is what we have to do. If suppose immediately nausea will happen, and what are the measures we need to take in order to avoid all these vapors. One thing is what generally I do practice. Usually, first after proper assessment of Agni, Dosha, Bala, and as well as the Prakriti of the person, even Vishesi, Rusumatra, everything they have told. Even after the proper assessment, when during the on the day of administration of this Nayana, if suppose after everything proper calculation, once again patient is having all these symptoms. What we need to do? One thing, if suppose Asya Praseka is there, Snehodhara means Sneha, what you can say, aversion to this Snehapana is there, and Shiro Gaurasa is there. In such conditions, the once again counseling and Yathasukam Vihare. That is also highly helpful. Vihare means not for the distress and all. They ask patient to not to sit in one place, and we need to make this diversion of mind is very, very essential. He should not focus as he has consumed Sneha Drava that in unaccustomed. Basically, Shodhananga Snehana. Snehana itself is unaccustomed method of the means it is not accustomed to the normal person, and it is very difficult even in diseased person also. That is a very important factor that we need to counsel even during this Nepal time. Okay. In such conditions, if one patient is having Vamana and even Uddara or Ashwadhara, Snehudhara and even Ashavarishar, in such conditions, generally, immediately after Snehapana, don't forget to give Saindava Jala, what you can say, Jiva Sparsha or ask him to take Saindava Jala, or immediately after that, we can advise successfully as it is told even in classics also, Kavala Gandusha. If it is not possible, simple Ushna Jala Kavala Gandusha is also more than enough. If not, Trikatu Kavala Gandusha is also ideal advisable. As you know that in Trikatu, people is the better yoga property that will enhance the administration Snehana has to reach faster in lesser time and it will reach shaka to the closer to the shaka also because penetration level of the people is more. That is one reason Tripatu Sadhita Jala Kavala Gandusha can be practiced immediately after this Snehapana. And even see, okay, they told Ushna the Upachari and all. Upachari means and even that Upasrishya, that is Achamanam, Acham means this washing of the hands and all. There are so many reasons they are told. Once again, in that also, immediately after Snehana, if suppose, usually generally what we will practice and what we will advise to our student, ask them to take in the empty stomach and even whenever patient will get appetite, ask them to take Lagu Ahara, Anabhishanda, Asakana, everything we will explain. Asankirana, that is usually your simplest form of the food. As Dr. Chandramalishwaram in the morning session told, what are the requirements of the Patyapachar dietary supplements during the Snehapana hour that we need to think. First and foremost, immediately after Snehapana, your body requires carbohydrates more than the protein and as well as already thought we have administered. In that form, that is the very reason the balanced form of Vipri, Yavagu, Manda, Yusha, Potassium, answers and all. This is a unique combination of the carbohydrate and as well as protein. If you give more protein, then it won't get digested during the first or second time, even during the Snehapana period itself. This is one aspect. Second thing is, okay, after Snehapana, Ushnadaka can be generally we are giving what level and how much quantity we need to practice. For example, today in Rusamatra, Rushisimatra, we are advising immediately after consumption of this Snehapana, you take that is Yadasukam. Whether how much is desired effect by the person because the requirement of Da, Krishna, and even Trishya, that is the thirst sensation, it differs from the person to person. That is based on the dosha itself. Okay. Here, generally, what we do follow, I will avoid immediately after Snehapana, I will advise to take one glass of Ushna Jala, that too by sip, and I'll ask them to take a patient to make Kavala and Kandusha, then I'll ask them to swallow it. Then there is a gap of minimum 3 hours, minimum, from first day and second day. Whenever dose is increases, I will allow them to, means I will advise them to take, give a gap of 4 to 5 hours and even because because of the Ushnata means electrolytes loss are given what you can say Rasakshaya in the body. Person they developed UTI symptoms on for third day and fourth day. That's what the Ushnodakapana, it should not be too less and it should not be too excess during this Neyapana. That is one point I have noticed regarding the Ushnodakapana. And what about other regimens, RI and VRI in case of the even on the day? Usually, as you have noticed that the first what the person they will feel about the hunger sensation, that is false appetite. That we should see. In how to assess the true appetite and false appetite, as they have told Jiramana Lakshana and Jirna Lakshana. Even many of the patients, due to their Amla Pitta and other symptoms, they will feel that by taking this Nayapana for the at the time of 7:30, that is the Udayagiri Sikar Samsiti, Pratakta Kanakanikara people at that time. After that, within 3 hours, they will get appetite. They will feel that that will be the true appetite. Then we will ask them to take Lagu Bhojana and even Ganji Tavale ಅಥವಾ ಬಿಸಿ ಇದನ್ನ ಕಿಚಡಿ ತರ ಮಾಡ್ಕೊಂಡು ತಗೊಳ್ಳಿ ಅಂತ ಹೇಳ್ತೀವಿ. And after that, even on the same day, they will add rice Virechana Vega or else rice Virechana Vega. Or even that will list the Virechana Vega. Because if the consumed food is not going to get digested properly, even food particle itself that will exit to the fecal material. That is the things what I have observed. Okay. That's why even for Ahara Sevana, Anna Sevana, as the classic told that the Tlinga Kandula and adding of the Sugandhi Dravya and even Yusha, Rasa and all. Sugandhi Dravya is basically it's indicated the adding of Chaturganga. Sugandhi Dravya either in Jala or even in Ahara form, that is to avoid the aversion towards the Sneha Dravya. And especially patients sir, ಈಗ ಯಾವಾಗ ಈಶ and all means that is nothing but Ganji what you can say that rice Dravya land. And even we can make some modification. Okay, let him take rice driven, but there should be some different formulations. What kind of formulations? Yes, sir. What kind of formulations we need to advise the rice driven in the form of that is ganji? You can ask them to take either it is prepared out of oats, millets, or even sometimes I will advise vegetable soups and even sometimes ragi and rave. These are the so many recipes are there. If you only stick on to the Annad Ganji Kavantam itself, it's not accustomed to the person and you even Snehapan and Samat Lakshana, and even the person will not complete the complete course of the Snehana, either Madhyama Matra, Madhyama Shuddhi or Avar Shuddhi 5 days or 7 days. These are the things what I observe. Okay. Here, see, Annapana. Basically, it is possible for taking the Ganji and all in adult case, okay. What about in case of Aravidi in children? And even some what you can say Bhov because the person are diabetic or person with so many other what you can say disease already and they cannot sustain the appetite till the stomach is the Lakshana. Is there any need of making the modification? No, you should not do, but still there is some little relaxation for the in case of pediatric condition. What kind of relaxation? We can make some different thing. Actually, they told what kind of bhojana means even few people they will open that those are should not be given and even it should not be given. Of course, the fermented food is strictly contraindicated. In spite of that, some instant prepared dosas can be given without using any sort of oil. Even that will change the rasa pratyanika rasa. That will help in the form of rasa pratyanika rasa so that the person is getting more confidence in taking or undergoing the procedure. These are the small modifications that we can practice. Yes, sir. Matra quantity once again. Matra can come for both water and RS Drava and as well as in even in case of the food supplement. Here already I told Matra it should not be exceeds and even the Agni should not be get depletion. That's why in that term we can in that quantity we have to advise Matra, especially either even in Ushna Jala Matra or even in Hara Matra. Previous time there is only two under in present you know what we can practice because children they won't sustain till the Veeramana Lakshana. Sorry, Veena Lakshana or till the evening. In such conditions, basic one thing we need to do that The usage of the MSG products or packed food should be strictly contraindicated. That will trigger the fat metabolism where the artificial gender is apparent. I hope the first and foremost thing is the artificial means the preservative added food should be avoided in case of the pediatric condition. That's one aspect. Second is, if suppose they they want to have any sort of food, even at least you should have 4 to 5 hours gap after giving the Madhyama or Alpamatra of the snail. These are the two things we need to practice. And usually patient children they won't accept to take Usna Jala. Usna Jala means there is so many questions. What kind of, how much, what temperature we need to maintain Usna Jala? Whether Sukhosna Jala is enough or Usna Jala enough or Ati Usna Jala enough. As Dr. Rai sir also told in the Buddhist statement, even in Brahmi and other conditions, Ati Usna itself, it will enhance the, even Dr. Sipa madam yesterday told, it will enhance the Dravaguna of the Pitta itself. Extra percentage of the Usna Jala, that will itself it will trigger the factor and it will give the complication. In such conditions, if the person is Bhaudita Avastha, if person is Pitta Prakriti, for him, simple Sukhosna Jala is more than enough while practicing of the Kriyapada. And Kala. What is actually, yesterday sir is also told and given some questions. Sir opinion, based on his practice, I do agree with you with his opinion. Sir mentioned it. 10 o'clock I will practice Samshamana Snehana like this. If I am correct. Okay. Here, Akala Matra, Akali Matre. Akala means what? Actually, that has to be given in the before the Surya time. If in the present condition, sir, ನಮಗೆ travel ಮಾಡಬೇಕು ಸೊ ಲೇಟ್ ಆಯ್ತು ಫುಲ್ ಆಗಿ ಎಫ್ಟಿ ಸ್ಟಮಕ್ ಎಲ್ಲ ಎಲ್ರಿಗೂ ಫಾರ್ ದಿ ಸ್ನೇಹಪಾನ. It is acceptable on the day one up to some extent, not in all the time. Not in all the time. Because that matra is very less. Even there is not too much of other what you can say, as you know that why you should practice Snehapana even in the morning hours itself. Okay. There is always Vista Costa is full strong, that is predominated by water basically, and even Alpha Leena dosha, or what is it? So, Kosha Liktata is made out of the Vishated dosha, sorry, Vishated dosha. Alpha Pramana of Vishated dosha are there in the empty stomach, and that won't charge. It is basically by inhalation, it will be there, and it will not charge any sort of Agni Dikya also. And it won't charge any sort of hampering of the Agni. That is the very reason, and as you know that I am Snehakara, sorry, Sneham Ayakara Purusha in that condition, usually the mid part of the body itself is predominant during the morning hours. It is the more amount of sneha is accumulated. That is the very reason what we can think the acharyas have been told for the Shodhana and Snehapana, Udayagiri, Itara Samskriti. If suppose we can excuse for 1 hour or 1.5 hours on the day, if suppose the patient comes more than after 9 o'clock, the places like Jangala in Ballari, usually Udayagiri is ideal time is around 7 o'clock itself. Even in the coastal area, Mysore and Udupi side, even 7:30, 8 o'clock and even 8:30 also they will practice Snehapana. In such conditions, definitely I noticed that in coastal area with a minimum dosage of the Sneha Dravya, they will patient will get stomach infection with a lesser period. Whereas in Jangala, as by inhalation Ruksha Pranadesha, it requires more dosage and more duration also. Here also, even the job means stipulated time, it should not exceed more than 1 hour or at the most 1.5 hours. This is my clinical observation. If we give the longer job, definitely it will get digest. Yeah, there should not be a nice agreement. Sagato means initial appetite should be there. It should not be Tivragni or Ati Gubiksha should not be there. That is the very reason that by keeping all these views or all these points in mind, it is better to practice Shodhananga Sneha before going for the Shodhana. Okay. What are the efforts? These are the tools we need to follow. What are the don'ts we have to practice? One is already we have told. See, the second line that stands for the mono related means the psychological related characters or properties, and in first line, Satran Motra Unlok Dara Mudanam not Dara. See, in classics they have clearly explained that Vedagana should not be there during the Snehapana. Likewise, even the forceful expulsion of the natural urges is also contraindicated. We have to keep both. If what will be the fate after if you are not performing these two? Once again, that it requires the need of the output sneha. It causes the motor vikaras. Okay, and as well as even the forceful expression that the enhances and that will triggers the metabolic activities or fat metabolism itself. I have told even that will enhance in first day and second day, as we noticed that other sneha darshan. Okay, even if you forceful expulsion or repeated expulsion of what is it, natural urges, that itself will hamper the fat metabolism and even the other darshan may be seen. That is one reason. That's what we need to avoid both of them. That's like this also Assam today also told the same opinion and only thing is they mentioned you need to avoid especially apatya. Apatya pana both the things they have mentioned. One is contraindicated and Ratri Jagana is also contraindicated. And in the present condition, how we can practice in case of the shift wise duty or the person those who are doing night shift will be there, hybrid mode duty will be there, and even they don't have so sufficient time. In such condition, does we need to practice Shodhananga Sneha or Shodhana measures or not? That will be the biggest question. And even it won't affect the places like Ballari. It is more applicable for the metropolitan cities where the overall number of companies, software companies are situated and located. Okay, in such conditions, the Divasatna and Ratri Jagana, those who are not following, they are strictly contraindicated to undergo this Shodhananga Sneha Pana. For that, Acharyas have been given alternate weapons or even measures we need to practice in the form of bhakti or in the form of pravicharana sneha. Okay, that we can practice. Totally, that is contraindicated. Next, please. See, here the person should not be too, that is, before the practice of this Neyapana, even the profession what we are writing in the office slips and all, that is also counts a matter, and it's why I am telling this, and even Acharya has been very particular about the restrictions of the Mansika Bhava, and even once again, this the control over the Mansika Bhavas is not possible by the children also. Okay, they if you will tell them don't sleep, they will not control and they will sleep. In such condition, there is slight modification of what you can say. Uh, Relaxation even patient has to give in case of the pediatric practice. But the person, those who are in teaching field, in such conditions, they come and they advise, they wanted to take a Snehapana or even a Shodhananga Snehapana, definitely we can give, but strict advice is you can attend duty, but you should not be targeted. That is the advice should be given by the physician. What will happen? Definitely, so many patients I have seen on the second day or third day, they will come up with an absence of the weight. Primary high school and they need to handle this continuous 2 or 3 or 4 hours. So definitely not only wheelchair boys, even the prolonged tachycardia should be contraindicated during this menopause. See, then points comes about before after these are the few considerable points on Tatkalina what you need to do and what you need to follow. Next point will come after completion of Neyapana and all, after how we need to assess the Nigda Lakshana. Usually Jiramana Lakshana and Jirna Lakshana. One thing you notice that once again there will be usually in Jiramana Lakshana Snehopdara will be there. Even in Jirna Lakshana Udgara Shuddhi, Indriya Laguta, Shiro Laguta, Gatra Laguta will be noticed. And as we are unable to find out and unable to conclude that based on Agastha Sneha Darshana, we cannot say that it's a Samak Nirta Lakshana. Likewise, even only with one symptoms, we cannot call it as completely the administered Sneha Drava is undergone for the digestion. We need to carefully assess pain or Gara Bhavat Chuddho. See, Chuddha Bhaktam Prati which is Tata. The person has to testosterone Mansate, it is most commonly seen in case of the Jara Prakarana. Patient is feeling hunger sensation, but is not getting desired effect by drinking the water and by taking the whatever he wants to eat. He will eat, but he won't get any satisfaction. There is no truth petal or there is no desiredness at all. Even this is one Food quality, as acharyas have been explained during the snehapana, the person should get desiredness by taking even water and even by taking patta in the form of either yavagu, vileti, whatever it may be, as explained, or where they have mentioned in the classic. Okay. Even in case of the Jirnamana Lakshana, that is through Daha, Brahma, Sada, Arati, Klama. These are the, actually we cannot call it as these are vapas. These are the physiological changes that has been taking place during the digestive process of the fat. And it doesn't require too much of treatment or attention also. Over the period, it by itself it is going to get subside. You just observe first to get the most. For example, if you give first day snehapana, these symptoms will occur within the 12 o'clock, means forenoon. If the person is taking consuming snehapana on 5th day, 6th day, or 7th day, yes, the dosage is longer and it requires more of the time to get digest, and the symptoms is still the evening. Okay. Based on that, we need to focus. Even some patients they will call us, sir, ಬೆಳಿಗ್ಗೆ ತುಪ್ಪ ಕುಡಿದಿದ್ದೀನಿ, ತುಂಬಾ ತಲೆ ಭಾರ ಆಗಿದೆ, ವಾಮಿಟಿಂಗ್ ಸೆನ್ಸೇಷನ್ ಆದಂಗೆ ಆಗುತ್ತೆ, ಆಗಮನ ಆಗಿದೆ, and even what you can say, ಉದರ distension of the abdomen ಇದೆ. These distension of abdomen and all, once again ವೈದ್ಯಕೃತ, ಔಷಧಿಕೃತ and ರೋಗಿಕೃತ are there. Usually that's a abdominal distension and all won't happen unless until person or the patient is not is consumed more amount of the Ushna Jala. That will once again hamper the digestion and it will prolong the period. That's what we need to observe all these common physiological changes during the undergoing for the digestion and as well as completion of the digestive process of the snail. Next, what we need to do is, suppose I told these are the physiological changes. Even over the period, it is not going to get subside. Yeah, if it is in Pitta Pradhana Lakshana, once again there is an Chandana, Ushira, Lepas are there, and even Jala Shukti consumed, and even Sukti Shamata, Yavagu they mentioned, and even Sita Jala Chandana Lepa over there, and even bathing the cold water. See, if suppose first day or second day, in between any one day patient feels like this symptom, then we need to stop this Snehapana or we need to continue. That will be the one person usually it will come in front of us. If suppose whatever it may be, it's a third day or fourth day, that day the person is feeling or even is suffering or is experiencing these symptoms, and even after making these efforts by application of cold charts or even other treatment regimens, if the patient is not is subsided and is comfortable within the next Snehapana Kala, then only we need to continue Snehapana. If any symptoms are there, then it is better to stop on the next day. Then we can stop means once again that Ushna Upachara, that is Achamana, everything should be followed strictly. And on the day, we need to once again continue with the same Ahara Vihara. Then next day, whatever that the last day dosage we have fixed, same dosage we need to re-administer. That is one method what we need to practice. And it is good also. Next slide, please. This is already we covered. And most of the Mansika Vyadhis, if the person is Satvika, usually he is having very good control over the Krodha, Bhaya, Shoka, and other Mansika powers. And in case of the Rajasika and as well as Tamasika, the moral attention and care by the Christian is required. Okay. And next, in case of Sukumara, Sri, Bala, and as well as Ruddha, there is a big debate. We need to go with Uttama Matra or Madhyama Matra. Even our scholars will have to raise the question. Basically, the always in case of the practice of Shodhananga Snehapana, why, of course, there is a naming change by the Acharya, but the other references, it shows clearly shows that there is no difference of opinion in the form of the Matra, especially for Shodhananga Snehapana. But practically, one thing we need to practice, they told Dvair, Chatur, and Asta, Yama, and all. Okay, so that is 6 hours, 12 hours, and as well as 24 hours. One we need to follow, which one we need to better to follow. Basically, they extend 2, 4, and as well as 8. But still, we have confusion by considering the other explanations told by the Acharyas before administration of the next day of Snehapana. The person should have very good sleep, person should have That's nice Jine Evane Shudaye Babu and Kshudato Anano Matyama Matra means the person should feel Isha hunger sensation, previous consumed food means not only Ahara Drava, even Sneha Drava also. Everything should get digested. If the person is having all these symptoms, then only we can go for the next day's Snehapana. In my view, and even I hope all are also upon the same, the Sneha which it requires minimum digestion period of 12 hours, maximum will be the 15 hours. That will be the ideal to practice Shodhamanga Snehapana in our clinical practice. What will happen if you take, no, I will practice within 6 hours or within 9 hours. Then, according to Agni Bala, we are not administering the appropriate Sneha Dravya. That's one point. If you cross more than, no, I will give up to, means like 20 hours, it will take up to 20 hours or 22 hours. What will be the fate? Then, the very next day is Agni won't get efficient to accept that increased dosage of the Sneha Matra. These are the few factors we need to consider before practicing of the Shodhananga Snehapana. Okay. And that more Annakala we can practice in case of the aged person. There is a Dhatu Chayatva and even they require often and often eating habits. Okay. And even in pediatric condition. And these are already we covered. Next question. Second question will come. Basically, first day again Rusomatra, Rusesi, after Rusesi, Ruswan Rusesi, one what will be the next dose? Yes, sir told you. So many and even you are practitioners. Most of the during Snehapana in terms of the Snehapana, maximum points are in case of the subjective parameters. Okay, this is the need of the hour of the faculty members. We need to develop some of the objective parameters based on that. We need to develop and we need to make some thought bearing to the upcoming scholars. They need to work towards in that aspect. In this regard, even Dr. Pulantikar sir and as well as Dr. Vaidya Vasant Patil, and they developed some of the parameters. According to them, next day those how we need to fix. This is one concept, and the rest of the thing is Jiramana Lakshana, Jena Lakshana, and even Manobala, Sharira Bala, and then all these are we need to consider. But why this counts maximum? One example, I think you might have all of you know the this calculation method. For example, that test dose what you are given. For example, 30 ml will be the test dose for one person, for me. Today I consumed around 90 ml of the given dose. Test dose divided by 30 divided by 90 into, for example, I took around 8 hours or 9 hours to get the digestion of the 90 ml of Sneha Dravya. The calculation should be like that. Test dose 30 ml divided by given dose is 90 ml into the time duration taken for the digestion, around 9 hours. You calculate it. For example, how much the question point will come? It will come around somewhere 2.7 to 2.8. It differ vary from person to person. This is the better way to keep this value as the ideal. And the next day, this I am telling for the first day. Next day we need to count or we need to increase the dosage means as you mentioned the Karsha is increasing in that Vangasena reference and other references sir also told. And Kumar something references sir. Yes, sir. That Karsha Pramana and all. Basically, that will help to maintain the Agni Bala. According to Agni Bala, administration of this Neha Dravi is possible by following this method. How I will tell you. If suppose 30 ml is first dose, next day so many practices are there. Whether fixed dose of snehana is good or even around snehana is good, there are different mode of the practice. But better way is that arona krama and it's palatable and even accustomed to the person where there is a dropout chance is very less in arona matra. Whereas in case of the uttama matra, dropout chance is also very more. Because patient continues, for example, Madhyama Shuddhi, 5 days you need to take same doses. If 100 ml or 120 ml is fixed for the fixed dose, 5 days you need to take 120 ml. But here there is a possibility. If suppose second of Snehapana, second day I took around 60 ml, patient feel any uneasiness, Chandra, Alasya, Kamaga, that Gaurav and lead develop. Next day, even we can minimize or we can continue with the same dose. There will be options are more in case of the R1 Snehapana. These are the practicality we need to keep in our mind. Okay. Next is suppose more than the 30 ml, if you increase the dosage, definitely that the value itself is more than, for example, 2.7, that value came on the first day. If it is increased, you are given doses and its value is around 3 points or 4 points or more, then definitely the duration, symptoms, even the getting the Jiramana Lakshana, everything will postponing and even it is increases its duration. That's one aspect. That's why always suppose one that is Shankana Shanka and even Agnata Costa is very difficult to assess the Costa and even doses. Based on this, we can refix the dosage during the Snehapana. Okay. Next. Generally, we will do Snehapana. How many days we require Sandal? What is the means the patient on what we are in what matters or even parameters. They need to give some focus and they need to observe. Usually, over the biomarkers, I think Dr. Santosh Shadali sir is there. When we have been to examination for the KLE institution, they had a very good works for the variations in the biomarkers during the Snehapana. Because as you know that ESR level is very high in case of the musculoskeletal disorders or inflammatory conditions. There also Snehapana is indicated. I'm not talking about the RHA factors and even other conditions. Okay, other than those. If you even first day to seventh day, there should be observation of the ESR level. What will be the on the first day and till the end of the day. Daily we can note the things. Is there any marked increase in the ESR level? What it indicates? If it is slowly or status quo maintenance of the biomarkers, what will indicate? And significant reduction in the biomarkers, what will give the impact or opinion, what it opens. Okay. Basically, ESR during Snehapana, it won't drastically increases or it won't drastically decreases during Snehapana time. There is a slight variables are there. Only I observed if unless until Sneha Atimatra means Ayoga Lakshanas is happened and even there is sudden allergic formations and all, in such conditions there is a too much of increase in the ESR level. Even lipid profile, what is the need of observing the lipid profile? As Snehana itself is indicated in case of the means that hepatobiliary disease. And even yesterday there is a discussion in fatty liver, we need to practice Snehapana or not. Okay, if we need to practice as itself in classics they mentioned in Pandu and as well as Pandu Rogito Pitalani Sevitan. Okay, in Pandu, yeah, there will be Rasakshaya and even we should dosha in Rasa level itself and even he requires Tivra Shodhana. Whereas in case of the actually Shodhana is indicated in both the showers, but in Kamala there will be the physical lysis or destruction of the dhatu, especially Rakta and as well as Mansa is going to take place in case of the Kamala, there the British Shodhana is indicated. Okay, this is nowadays if you take lipid profile and as well as USG of the abdomen, out of 10, more than 8 patients, they will come up with a grade 1 fatty liver. And what are the measures we need to practice or we need to take before practicing of this Snehapana? That will be the question. In such conditions, we need to opt for the appropriate, what you can say, the formulations or yoga of this nature. Usually, the Indukanta Krita or even that will be the best choice, and the Pitla Krita is also one of the best choice. And to avoid, even I noticed that during Snehapana, in only one patient, that by accidental findings, after Snehana Dravya, grade 2 fatty liver itself is came to the grade 1 fatty liver. Even I am unable to, what you can say, put in front of you how it is turned or reverses the conditions. Second grade to first grade, and even my friend Dr. Chandramouli or even other faculty members, I seek their help. It may be accidental or it may be truly happened in that patient, or is it possible to convert from grade 2 to grade 1 fatty liver during the Snehapana? That's one question. And basically, when fatty liver comes, the most of the patients they will come up with the question that, sir, already there is a fatty liver in me, and if you are administered Snehapana and all, does will not trigger the my health and all, because everyone already we are all the students of Google. They will come up with, they will search and they will ask so many questions. Okay. In such conditions, so first and foremost thing is the standardization or even the assessment of proper Krita is the basic need according to my opinion. Whatever that Krita which are available in the market, we are believe that that is a pure and all we are administering, and even so in many cases, even the lipid levels during Snehapana is triggered, and even what you can say the albumin values also in case of the diabetic persons during the Snehapana that triggered. These are the some observations what I made. And even one more notice, and you people also notice that during diabetic patients, Neopana itself is more than enough uh, to control the RBS level. And our students also notice in very few, what you can say, in large patients itself, the RBS level from first day to 7th day definitely is going to minimize this, and later it may be due to the what you can say, the non-administration of the glycemic drugs. Okay, glycemic test during the Snehapana, that's one reason. Second one is the liquefaction, and that's one reason. And second reason is how this is happening. Actually, our intention is to increase how much time? Okay, 5 minutes are finished. See, we are giving Snehapana, the intention of giving Snehapana itself to increase or make a utlation of those itself. Okay. Either, of course, RBS is the biomarker synthesis of the Pramaya, Madhumaya and all. Even, basically, it should increase its value. In such conditions, in few conditions like diabetes, it will decrease it. Okay. And after Shodhana, once again, it comes to control, that's different issue. And what is the limitations and scope of this Neyapana in case of the Madhumaya, that we need to think, and we have to work more on that aspect. And even the presence of the bile salts, bile pigments during this Nayapana will also give a crucial hint for the practitioner. Okay. Even the increase of the bile salts, bile pigments, and even the what you can say, availability of the first cells more or RBC cells more, then definitely there will be a lot of this Naya even on 5th day, 6th day, or even improper selection or selection of this Naya into particular cases that we need to think, and we have to rectify for the guidance in my week. Because you have given that I don't know Satyamana. Given references that regarding the Vishnodakupachari. In Shastra, they mentioned that Vishnodakupachari not only for the during the Snehapana duration, he has made up to it, it is even the Purva Karma, and even in classic they mentioned couple of days early, the person should follow these regimens. That is very ideal to avoid the foremost complications or possible complications caused by the under the context of Shodhananga. Next, next. Yes, these are different arteries open support this discussion point. See, once again, this is actually there is a difference of opinion. The discussion point is the proper objective. Our dosage, which one is good or superior. Both are having pros and cons, fixed dose and as well as Arvana Krama. That the patient is up to the patient, they need to practice. And Anupana, according to Kala and etc. Anupana, see, usually Usnadaka, even in the places like jungle, it requires lukewarm, and even in liquid regimens. And the next is the significance of Uttama Matra and Madhyama Matra. Once again, the Uttama Matra, I told that is going to minimize the complication and that will enhance the appreciation of the semester direction of the stipulated period. These are the few points where we need to discuss, okay, for the proper conclusion. Next point, once again, there is an as it is an unaccustomed procedure, it requires proper counseling. These are the case of the Snehapana and proper assessment of Agni, Kosta, and as well as Desha is plays a crucial role in obtaining this correction. And third one is the compromising the Matra Kala and Patya list to offer, but there is exception in case of in the practice of Jara and as well as in case of the Bala Rogas, and the objective parameters has to be developed in case of above said matter, and they matter should get digest within 12 to 15 hours. These are my opinion. Thank you for your patience hearing. I don't know if you are sleeping due to effect of but holding it. That's deep effect. Thank you, Anand. And I thank to my HOD and principal sir for giving me an opportunity to share my few experience in front of you people. Thank you, Anand.